Today, I will discuss the meninges of the brain and the spinal cord. The cranial meninges. The brain and the spinal cord are covered by 3 layers of meninges. Who are these 3 layers? Number 1, dura mater, which is the outer layer. 2, arachnoid, and 3, the pia mater. The dura mater is the outermost one. It is surrounded and support the dural venous sinuses. I will discuss it later. But I want to remind you, the dura mater is formed by 2 layers. Who are they? A, the outer one, we call it periosteal. B, the inner, we call it meningeal. This is the picture. Just look here. This is the bone. This is the skull. Outside the skull, you remember, scar. But I'm going to discuss the inside. Here, 2 layers. Can you see them? This is, we call it periosteum, periosteal layer. This is, we call it meningeal. Both of them, we call them dura mater. Down to them, this one purple in color, this one purple in color, we call it arachnoid, and this one blue in color, we call it pia mater. And then you can see this is the brain tissue. If we cut the bone of the skulls, right away we are going to see the dura mater. Here, another picture shows you how the dura mater is formed by 2 layers. The outer, endosteal. The inner, meningeal. What is the difference between endosteal and meningeal? The endosteal layer does not extend through the foramen magnum. What does this mean? Endosteal layer only covers the brain, while meningeal covering the brain and the spinal cord. Now the meningeal layer, the inner one, it forms 4 extensions. Who are they? Falx cerebri, tentorium cerebelli, falx cerebelli, and diaphragmacelli. This is the picture. This is the picture. This is tentorium, this is falx, diaphragmacelli, and here is falx cerebelli. They are 4 layers. In the falx cerebri, we have sinuses. I have a picture. I will show you. This is the falx. In the upper border here, we have the superior sagittal sinus. Superior sagittal sinus. While this one is inferior sagittal sinus. This is, we call it citrate sinus. Here, transverse sinuses. And I have another picture of the extension. This is another picture, transverse section through the cranial cavity. Can you see this one? This is transverse sinus. This is another transverse sinus. At the end of this is S-shaped sinus. We call it sigmoid sinus. And another sigmoid must be here. While, can you see this layer? This is the tentorium is not removed. Tentorium cerebelli is not removed, while here is removed. From the upper border of the sigmoid, there is a sinus extend here. We call superior petrosal sinus, and here inferior petrosal sinus. Both of them going here to this big sinus, we call it cavernous sinus. This is another picture, how the sinuses look for. Now, if we look, this is a coronal section, a big section. I want to remind you, this is pituitary gland. And here is the sinus, we call it cavernous sinus. cavernous sinus. Inside this sinus, there's an artery passing, which is internal carotid artery, and another nerves passing at the outer side of the sinus, and another one which is passing through the sinus. What about the arterial supply of the dura? Coming from internal carotid artery, from maxillary, ascending pharyngeal, occipital, vertebral, and middle meningeal artery. The nerve supply of dura mater, coming from trigeminal nerve. You remember the trigeminal nerve is sensory to the face and vagus, and the first three or upper cervical nerves and sympathetic fibers. That's why sometimes if you have a pain in your teeth, what will happen? You will have a headache because V3 mandibular branch supply the teeth and at the same time send a branch to the dura mater. Or if you have problem in your vertebrae, you will have a pain in the head because of the nerve supply coming from the cervical region, and so on. Another picture, I want to discuss the arachnoid and pia mater. Here, can you see this layer? It is very vascular, transparent, covering the brain, but it is not passing in the sulci between the gyri of the brain. Here, the dura mater is reflected. This is the arachnoid. The arachnoid. Can you see the vascularity? It is very transparent and vascular region. Here, it passing subarachnoid granulation into the venous sinuses for the drainage of the CSF. The pia mater, thin fibrous tissue, impermeable to the fluid. And this is the picture. Can you see the difference between this picture and this one? This is the brain without covering. This is a brain is covered by the pia mater. Can you see it?